The last point I wanted to sort of make here was, some of the newer PI3 kinase agents too. So, we have Inavolisib, and I think that when we talk about things like hyperglycemia or rash and all, we do need to remember that these are class effects. And so in some of even the newer drugs, these are things that can happen as well.
Yeah.
What's your experience with Inavolisib been so far?
Yeah, I agree with you. Even though Inavolisib has some properties of being mutant selective and wild type sparing, I certainly still see hyperglycemia in the patients that I treat with it. And we know from Inavo 120, we saw, again, a very restrictive trial in terms of enrollment. So patients were restricted to have a hemoglobin A1C less than 6 for eligibility. And despite that, over 50% of patients had hyperglycemia. So even with the wild type sparing, we're seeing some of the hyperglycemia effects.
Yes, a big challenge in this pathway for sure.
Yeah.
And of course, I do want to make sure that we're comparing apples to oranges of Inavo 120 being approved in a different setting, which is the first line setting in combination with palbociclib and fulvestrant for those patients who were recently relapsed on their adjuvant endocrine therapy.
Right.
So a little bit different patient population, but important just when we're thinking about drugs that are targeting this pathway, of course. Each of them has their very different clinical trial criteria, and toxicity profiles are quite a bit different.
Yeah.
How do you feel about diarrhea with Alpelisib versus Capivasertib versus maybe Inavolisib?
Yeah. I mean, I've seen diarrhea with all of them. I would really say it's a class effect. And like I said, the Imodium is key. I mean, having that conversation to educate about Imodium off the bat to make sure they've got it on hand, do they use it right when the diarrhea starts so that we're not chasing and really sort of being proactive about it has helped tremendously. And I think your comment about particularly those patients who were either on metformin or starting metformin prophylaxis, being very careful about the overlap diarrhea is really important too.
Yeah.